That burning pain in your stomach has been coming and going for days. Could you have a peptic ulcer?
Peptic ulcers are open sores that develop on the inside lining of the stomach and small intestine. The ailment is common. 1 in 10 Americans experience a peptic ulcer eventually. Although peptic ulcers cause similar symptoms no matter where they occur, they have different names based on their exact location in the body. Gastric ulcers occur in the stomach, while duodenal ulcers are found in the upper part of the small intestine, the duodenum. Unfortunately, peptic ulcers are not just common, they're painful. Most often, the burning pain is felt between the navel and the breastbone. Gastric ulcer pain may occur soon after eating. Duodenal ulcer pain may occur or worsen when the stomach is empty, usually 2 to 5 hours after a meal. Symptoms may also happen at night between 11 p.m. and 2 a.m., when acid secretion tends to be greatest. Unfortunately, peptic ulcer symptoms may not be relieved by eating or taking antacids. So, what causes peptic ulcers to form in the first place? Doctors once thought that spicy foods and stressful situations were responsible for ulcers, but those theories have been abandoned. Now, researchers know that most ulcers are caused by infection with a corkscrew-shaped bacterium called Helicobacter pylori, or H. pylori. H. pylori is thought to be spread via contaminated food or water or through the exchange of saliva. Infection with H. pylori is common in the United States, but most infected people do not develop ulcers. Sometimes, though, H. pylori manages to burrow into the protective mucus coating which lines the stomach and the duodenum. This mucus is meant to block the digestive acids made by the body, thereby protecting the stomach and duodenum. Once H. pylori penetrates this protective shield, however, both the bacterium and the stomach acid can enter the mucus and irritate the sensitive lining, thereby resulting in an ulcer. While doctors agree that invasion by H. pylori is the main cause of peptic ulcers, it is not the only one. Regular use of painkillers called nonsteroidal anti-inflammatories, or NSAIDs, may also lead to ulcers. Drugs in this group include aspirin and ibuprofen, as well as prescriptions like diclofenac. NSAIDs may lead to ulcers because they inhibit the body's production of prostaglandins, which when present shield the stomach lining. In addition, smoking and excessive alcohol consumption have been shown to lead to ulcers by increasing stomach acid production and irritating the stomach's protective mucus. Left untreated, peptic ulcers can eat a hole through the wall of the stomach area, putting an affected person at risk for infection of the abdominal cavity. In addition, peptic ulcers can produce scar tissue that may obstruct passage of food through the digestive system, resulting in vomiting and weight loss. Luckily, these consequences can be avoided if peptic ulcers are diagnosed and treated early. For this reason, it is important to see your doctor if you suspect you have a peptic ulcer.